Hello everyone, welcome back to Self-Help Acupressure. Today we will focus our talk on how to manage neck pain. The most common cause of neck pain is a muscle strain in which a muscle is stretched too far, resulting in its tear. Neck muscle strain is typically caused by poor posture or support, such as sleeping with the neck in awkward positions. A feeling of neck stiffness, muscle spasm, or nagging soreness in the neck may be felt. Pain may get worse when you move your neck. Torticollis is stiff neck caused by spasmodic contractions of muscles of the neck, drawing the head to one side. Now, more than 80% of the people older than 60 are affected by cervical spondylosis and experience similar neck pain. There may be associated dizziness and headaches. Cervical spondylosis is a general term for age related wear and tear affecting the spinal discs in your neck. As the discs dehydrate and shrink, signs of osteoarthritis develop, including bony projections along the edges of the bones. If spondylosis causes pressure on the surrounding nerves, it results in numbness, tingling, or pain radiating to the chest and ribs. In such a situation, you must seek orthopedic or neurosurgical consultation. Generally, non steroidal anti inflammatory drugs, steroids, muscle relaxants, and anti seizure medication are prescribed to manage these patients. However, acupuncture and acupressure too can play a significant role in tackling neck pain and eliminating the need for this excessive medication. The points to be mentioned here are to be compressed bilaterally. You could do it yourself or have an assistant help you. The first and most important point is the gallbladder 20 or GV20 point. It can be found at the junction of the head and neck at the back in the hollow between the mastoid bone and the occiput. It can also be located on the nape of the neck at the apex of the posterior triangle, that is, the depression which lies between the insertions of the sternocleidomastoid and trapezius muscles. Use the thumbs or knuckles to apply pressure on both sides for 10 seconds. Then make a vertically downward movement for 1 to 2 inches. The next point is the urinary bladder 10 or BL10 point. It lies between C1, that is the atlas, and C2 vertebra, the axis vertebra, approximately 1.5 inches lateral to the midline. If the practitioner places the middle finger on GB20, the shorter index finger will be pointing to BL10. Apply pressure for 7 to 10 seconds on both sides, best compressed by the index fingers. Now press the brain channel point, that is DU14. This point lies below the spine of the C7 vertebra. The C7 vertebra is the most prominent vertebral spine in the cervical region. Again, apply pressure for 7 to 10 seconds at DU14 with any finger. After the neck points, apply pressure on gallbladder 21 or GB21. This is located midway from the point DU14 below the C7 spinous process and the tip of the acromion, and on the highest point of the trapezius muscle on the sagittal plane. Apply pressure on both sides The middle finger is convenient for applying pressure if self-help is being resorted to. There are two distal points on the hands for alleviating neck pain and should also be accessed. The first is small intestine 3 or SI3 point. This is located at the junction of the head and shaft of the fifth metacarpal bone. An easier way to locate it is by seeing where the most distal transverse crease of the palm ends. When making a fist, a small bulge forms at the end of the crease. This is the SI3 point. Use the thumb of the opposite hand to apply pressure at this point for 10 seconds. The last point to be stimulated is the large intestine 4 or LI4, which is the universal analgesic point. This has been used extensively and demonstrated in the earlier videos. It lies on the radial aspect of the hand between the first and second metacarpal bones, closer to the second metacarpal bone and approximately at its midpoint. Spread the thumb and forefinger and place the distal phalanx of the thumb of the other hand on the web border. When flexing the thumb, its tip will point to LI4. Now let's recap. There are 6 points to be addressed. 4 points are located around the neck and 2 points are distal points on the hands. Notice 3 hollows below the base of the skull. Hollows on the sides are GB20. Apply pressure on GB20 points with the help of middle fingers for 10 seconds and then slide them vertically down 1 inch while maintaining pressure. Next, stimulate bladder 10 using middle finger as a guide by using middle finger and index fingers together. Place the middle finger on GB20. The shorter index finger will now be pointing to bladder 10. Press bladder 10 points with the index finger for 10 seconds. Remember, this point, bladder 10, is better stimulated with the help of an assistant. Next point to stimulate is DU14. For this, notice the most prominent cervical spine, that is the C7 spine. Use the index finger to feel the C7 spine. Then apply pressure below it for 10 seconds to stimulate DU14. GB21 is generally easily located as it is on the highest point on the shoulder on the trapezius muscle. Technically, it is vertically above the midpoint on a line joining DU14 and the tip of the acromion. Apply pressure over GB21 with the help of the middle finger for 10 seconds. For locating small intestine 3, clench the fist and observe a bulge at the medial end of the distal transverse crease. Place the index finger tip over the bulge and apply pressure for 10 seconds to stimulate the small intestine 3 or SI3 point. Finally, apply pressure on large intestine 4 or LI4 by approximating the thumb and index finger and pressing the highest point on the bulge. Generally, this session may provide more than 90% relief in cases of neck strain. For cervical spondylosis, repeat the procedure at least twice a day. This will give intermittent relief and you may be required to perform the procedure daily.